what we've done is we've added different services, okay, that have been tailored, to the patient.
Mm-hmm.
Because it was really a no-brainer for SIVA, okay, to start a congestive heart failure clinic, okay, up here in the high desert. Really a no-brainer. Because in coming off of the conversations that he just had with you, okay, I think the audience will come away with getting the impression that not only is Dr. Siva an interventional cardiologist, but he treats the entire patient. Okay,
right.
And you got that. I think you got that thought process. And see, we talk about it, and this is how we do this. Because as an internal medicine physician, cardiologist, interventional cardiologist, we treat the whole patient. So when we started the heart failure clinic, 18 years ago now, it was designed to keep patients out of the hospital.
Mm-hmm.
It was designed to educate our patients and empower our patients for them to know more about their disease processes and multiple disease processes, so they can do more for their own health. So when Dr. Siva was talking to you about different things for exercise, the right foods to be taking in, okay, you brought up the point about, I think was important also, the necessary sleep, amount of sleep we need, okay, during these times right now. Really, really important. As we get older, okay, sleep has been very, very important. Stress reduction. For myself as a nurse, we look at the disease prevention. Dr. Siva gets involved from the interventional cardiology, not only from the coronaries, but from the carotids and from the peripheral and from the renals and from the aorta, from the AAAs. So it's the entire body that he's basically doing the intervention on, that aspect of it there. But this, going back to your question about microcirculation, we've have patients in our EECP, they come in for their therapy, and what we find when we give them our Arginetix complex 30 to 45 minutes before their treatment, okay, not only does what Dr. Siva talked about the vasodilation benefit from the arginine nitric oxide process happen, but what happens is that these patients are now finishing up their EECP therapy, Bill, with coming out and saying, gosh, I can do things around my house in about half the time. I'm cleaning the kitchen in half the time I was doing it. I'm going out, I'm doing, cleaning the yard. I'm doing things that we call ADLs, or activities of daily living. I'm doing my ADLs in half the time that they were doing it before, and that's quality of life improvement.
Right.
Okay, we're doing that process right there going through. So it took us a long time to develop this product because what we needed other ingredients that weren't just about arginine citrulline, but we wanted to make sure that we had the proper antioxidant ingredients in there also that just happen, okay, to come in line with what we're going through right now worldwide as a pandemic, okay, in this process right here. And this pandemic, unfortunately, is putting a patient population with obesity, with hypertension, with diabetes, is putting that patient population at a higher risk, okay, for their immune response, as Dr. Siva was saying, for their immune response to fight that.
Right.
And as they age, okay, is lowering their immune response also too. So this is where we have used our vitamin D to give a patient population such as our PAH patients, our pulmonary hypertension patients. We've doubled their vitamin D for a period of time of 2 to 3 months while we're going through this process here. And then we'll bring them back in, get their vitamin D levels, because as Dr. Siva was telling you earlier, here we are in the high desert, Bill, with sunshine 300 days a year out of the year, and we still had a very high patient population that was deficient in vitamin D. And besides what he was telling you about the benefits of vitamin D, it's also really important to note that it really helps the immune response. Okay, it helps for help for depression, even on people who are not have a history of depression. So what have we been doing for these last 6 weeks here in California? We've been keeping many of our patients sheltered in at home. They're not going out and getting their sunshine, their sunshine vitamin D. And so what we're doing is we're making sure that they're getting additional vitamin D and this aspect so they can have a stronger immune system, better cardiovascular protection. That aspect, many of our patients who have a history of osteoporosis for bone health and that part of it they're going through. And then we've also added our MiniQ7K2 to our vitamin D, because what that's also doing is, in that dosing, is reducing arterial stiffness. It's helping that patient who has hypertension, because, as Dr. Siva pointed out to you, what can also cause a problem with the immune response is increased stress.
Right.
So I don't know about you, Bill, but being home with your wife and being inside all this time with the wife and kids and everything, that just right there sort of raises the stress levels a little bit also. And I'm married to a nurse. I've been married to a nurse for 43 years. We sort of been able to sort of bounce things off each other at the same point in time, but we're also side by side and for a long period of time. Also.
I wonder if there's a sort of correlation between everyone having to stay at home, forced to stay at home, watching the TV, being intimidated by what they see on the TV. Lack of education is what's going on. And then not having exercise, but not having blood flow, and not having intellectual or athletic stimulation just perpetuates the problem in itself. I mean, yeah, you can stay healthy by avoiding by avoiding the outside and reducing your exposure to COVID, but at the same time, you're basically creating another life form of a problem by having insular existence kept inside, devoid of society, out without any metabolism, intellectually or physically.
I think you probably picked up a little bit of that from Dr. Siva's response to how he's trying to really keep COVID in light of our other different viruses that we've had and had to deal with at the same point in time. That aspect of it they're going through. Also, being a former professional athlete such as yourself here in Southern California, with what we're used to, and that aspect of it they're going through, we need exercise. We need to be outdoors. We need the aspects of that component they're going through. And from the nursing component, these are the kind of things that I always try to be. When I was doing triathlons and marathon, I was trying to be that example to my patients, of what they should be doing as far as exercise also too. So we don't want to get into another. There was a saying in the only difference between a rut, the grave, or the dimensions. So the rut that COVID-19 has given us, we don't want to turn into the grave. That aspect of it there that unfortunately has killed so many Americans and also worldwide pandemically. But this is a rut that we will get out of. And I think from the nursing standpoint, in my nearly 3 decades of nursing, over 3 decades of nursing now, it's been something that's been incredible for me to deal with. I've had to be there. I know how the critical care nurses are feeling with when they have to be the nurse, the preacher, or the priest, and the family member at the same time for someone leaving this world. And so think of the stress that is causing to the caregivers. Stress is another situation that can reduce your immune system.
Right.
So we in healthcare need to keep our immune system strong. We need to be able to have those outlets and those support groups in our that we have. I set it up for my PH patients, so we keep them home. We make sure that all of our patients have a good support system, and at the same point in time, my wife and I sort of use each other as nurses as a support system to balance that off. Siva and I use each other, and that aspect of it they're going through because of the patient load that he has. So this is a incredible time, but it's also an important time to be able to educate the public more of what they're able to do. As Dr. Siva was saying, the common things to do.
Right.
That aspect of it they're going through. I think our world is going to be changed for a while. regarding to social distancing,
Mhm.
okay, safe, because I don't want things to open back up again. But I think it's interesting. Knock on wood, none of our patients who are taking this product, okay, have tested positive. They're healthy, and so I think it's something that that from the nursing standpoint, from prevention, I think it's very important to know.
And even if they did, I don't know, you're not making a statement when you say
No.
this, but an opinion. Even if, let's say, I had tested positive, it seems like from a common sense perspective that having an immune therapy such as vitamin D, extra vitamin D, or extra arginine and blood flow in my circulation would have prepared me better, for lack of a better word, than not having that issue. Because from a layman's standpoint, what I hear about is there are strokes, there's inflammation that is associated with COVID, and to what Steve was saying, that could happen with any virus or flu. But it's just common sense. Your immune therapy, your ability to support yourself, is the basis of taking the fundamentals of vitamin D and having your blood flow circulation. And so whether or not that's in a supplement, or whether you eat, or your exercise, your diet, the purpose is to keep that going regardless and prepare yourself.
Right. Remember, the greatest majority, okay, of people who test positive, everything will get through this, okay, just like
Right.
Dr. Seaver will say, we'll get through this, okay, without any problems.
Yep.
And that's our goal. So our goal is to be able to have a sort of, I like to have on my plate, okay, I like to have on my plate the proper dietary regimen, okay, along with the proper nutritional supplements that I can have as I mature, as I get older, okay, to be able to utilize for my own health and well-being and for the people around me. And so, yes, this is not something this is not something for the treatment. This is something utilize that's in my toolbox,
Right.
okay, that I get to be able to, through the thought processes and through the open thinking of Dr. Siva, because again, this has been something that's been in the making for many years, and when I've been very blessed to be able to work with a cardiologist who thinks outside of the box when it comes to looking at how we can look at pharmaceutical grade nutraceutical products to be able to use in complementary process with other treatment modalities. So as he was talking about other treatment modalities that are out there being tested right now, they're being used. Combination therapies being used for patients who are testing positive right now. I think that this is something that, from a disease prevention, from a nursing standpoint, I think this is something that we need to always have a chance to look at.
I suspect that now that things are getting lifted just subtly and smallly, I know that we're still under general protocol till, I guess I heard today, till in July. So, and that the types of exercise people will be able to conduct will be solo. Mm-hmm. You won't be able to have like a big basketball game, anytime soon. There won't be big competitions happening. I'm not even sure if gyms will be open, but people can be able to run outside and take long walks, and hiking will be sort of a mode of athletics that people are going to be encouraged to do for the next 5 or 6 weeks. It's probably the one thing people can do.